A cluster of type A influenza cases has been confirmed in a care ward at Taipei City Hospital's Heping Branch. The pathogen spread from a 51-year-old woman who was hospitalized for flu complications. She was pronounced dead on Wednesday, and the strain has since spread to 6 nurses and 7 other patients. Doctors have placed the infected care ward under quarantine. The stricken patients will be monitored until the end of the month.
It was a full house at the hospital this morning amid an outbreak of influenza A. There were an additional 57 severe flu infections over last week alone. Taipei City Hospital's Heping Branch has reported a fatal cluster of influenza infections.
A 51-year-old female patient had pneumonia that is believed to be a complication of the flu. She was sent to Taipei City Hospital's Heping Branch and hospitalized, whereupon she received proactive treatment. Due to the severity of her lung infection, she was transferred to the intensive care unit for proactive treatment. The medication used to treat the virus was ineffective, and she was pronounced dead on January 23rd.
This patient's strain of influenza A has infected 6 nurses and 7 other patients in the care ward, according to Taipei City Hospital.
We have taken precautions in the care ward. Patients can only move out, not in. Right at the outset, we administered preventative medication. The ward will be monitored for new cases for at least 7 to 8 days.
Doctors have extended the quarantine period from January 29 to January 31st. Taiwan Centers for Disease Control confirmed today that it's because doctors suspect a new case that indicates the cluster infection is not yet under control. Taiwan CDC has issued another warning that flu season will peak during the Lunar New Year, with hospitals set to be packed on February 6. Taiwan CDC is working on adding clinic availability over the holidays, and it urges the public to get vaccinated.